Hi, my name is Michelle Werner. Thank you for allowing me the opportunity to talk to you about my opioid treatment access database. I will be proposing this database for you today. Research has shown that death from opioid-related diseases has increased 6 times as those in 1999. The biggest of these increases can be seen in underserved areas that lack treatment for addiction. The following database proposal is designed to aid physicians in offering treatment where it is needed the most. We need to offer treatment for these individuals regardless of socioeconomic status that is seen in underserved areas. Goals and objectives. The goal for the proposed database is to increase the availability of treatment such as the use of Sublocade. Another goal would be to expand the access to modern treatments that have been successful. However, the ultimate goal is to reduce addiction by implementing addiction treatment in underserved areas. Treatment is crucial. This proposed database will help locate the areas needing treatment the most. The database that is being proposed can reduce the need in underserved areas by 10%. Furthermore, with the right database, we can improve both patient care and an addict's quality of life. By implementing this database, we will be able to target areas needing access to treatment, improving access by 25%. As a result, we can reduce opioid dependence by 15% in these underserved areas. Who will use the database? The proposed database will be used by treatment facilities, providers, therapists, and social workers. The type of data that will be collected include data collected from the Substance Abuse Treatment Program, known as SATP, from patient profile, emergency room data, and patient and provider demographics. Reports to be generated for analysis. The number of ER visits related to opioid abuse will be reported through this database. Treatment facility accessibility of a 60-mile radius or more from the addict will also be reported in this database. The number of opioid-related deaths in underserved areas will also be included. Database schema. Database schemas are an overview of the data that can be found in the database. They assist with making the tables in the database more identifiable. In addition, it shows a relationship between tables in the database. The purpose of the proposed database is to illustrate the relationship between patient records, treatments available, which areas are underserved, the patients, and the providers. Furthermore, the database schema will provide the different attributes associated with each of the following: patient, provider, underserved community areas, treatment facilities, opioid-related ER visits. Here is a visual example of how the entities and their attributes are related. For example, if you look at the ERD, the patient and provider entities have a one-to-one cardinality. Additional information about the proposed database schema can be seen in the data dictionary of the database. A data dictionary is kind of like a set of instructions to be used to facilitate users about data used and collected in the database. When discussing different elements of the database, it is important that the same references and terminology are utilized. This will reduce a lot of confusion when using the database. Please see the data dictionary tables that are listed in this slideshow, and if you notice that each table represents one of the entities in the database along with their corresponding attributes. This database will collect data and allow us to perform different SQL functions on the data. This example was done to create a table using the data that was collected in the database. And this next one, we added a column to the table and we populated the data in the table. And then this example, we have an SQL query that uses the count function. And finally, we have added a marker column using SQL. Marker column can be very important when utilizing a database and uploading and downloading data. By using a marker column, you are essentially performing a soft delete. If you delete a row, then you are permanently deleting the data. To be retrieved, for example, the wrong information got deleted. There are several advantages by doing a soft delete. As already mentioned, undeletes are faster and easier. Another advantage is that the data can be gotten a hold of longer. For example, you may want to hang on to the row data for auditing purposes. Another reason that you may want to hang on to deleted data is so in the event of a disaster, the recovery process will be a lot easier. These are all benefits to doing a soft delete by adding a marker column. Business rules related to proposed database. When designing a database, it is crucial to organize and record the business rules associated with it. Through these rules, an individual designing a database can develop the relationship, participation, and challenges of creating a correct data model. In addition, the designer needs to understand the business processes through the nature, role, and depth of data in order to be successful in designing a useful database model. In the proposed database, the following business rules will apply. Multiple records may be generated by an individual patient. A patient record is generated by one individual patient entity. A provider may prescribe multiple prescriptions. An addiction treatment facility may facilitate many patients. And also, a patient may seek treatment at more than one treatment facility. Possible limitations and extensions. One limitation of the database would be during data collection. Even though underserved areas need the treatment the most, they are probably the hardest areas to obtain and collect data. If the database doesn't promote interoperability of data and the importance of being able to access data, the database will be faced with challenges. The proposed database has several extension possibilities. It will be unlike any other state and federal databases. The proposed database will be designed to incorporate data from underserved areas and basing the database around the needs of individuals suffering from addiction. This database will prove to be more accessible to providers and facilities collecting the data, and it will be designed to automatically update as data changes. In conclusion, this project is focused on the emphasis of improving the outcomes for those dealing with opioid addiction and decrease costs related to care. By tracking this data and being able to draw conclusions from the data collected, organizations can make adjustments to current regimen of care. It will benefit this patient population as well as those affected by the opioid epidemic we currently face. Additionally, facilities could demonstrate their new practices for other facilities across the United States to potentially model and implement after. Thank you.